Good evening, everyone. Thank you for joining us this evening for the community outreach for Cedar Rapids Community School District policies and practices relating to crisis prevention, de-escalation, and intervention. This is a community presentation, and I will be taking you through it tonight. My name is Sandy Schmitz. I'm the Executive Director of Behavior Supports. The Cedar Rapids Community School District entered into an agreement with the United States Department of Justice on September 12, 2022. When all requirements are fulfilled, the agreement is set to expire with a target date of June 30th, 2026. So we will have been in this agreement for 5 years at that point and are hopeful that we will have met all requirements at that time. So there's a lot of work to be done within the agreement, a lot of things to be worked out, a lot of details, but we're really viewing this as a great opportunity for our school district to review how we can enhance our behavior supports for all students. So it's a great opportunity to work internally with our resources here, but also with the community who also provide supports for our students in the area of behavior, and that we can just make a better system of supports for all students. You will see on this slide a QR code on the screen. Please use that code to submit any questions that you might have. We do capture all of the questions that we get on our YouTube presentations, Zooms, because it helps us to better articulate our message, perhaps, and our communication. And then we do often send out responses to those questions through a Q&A or maybe the newsletter, some other type of communication. So please do take advantage of that QR code. I'm going to show it again at the end of the presentation, but we would love to capture as many questions as you have. So the top 5 changes that the district experienced as a result of the DOJ agreement include, I'm going to be talking about each of these in further detail, but you will see that there's 2 basic categories. We have crisis prevention and we have crisis intervention. Crisis prevention is efforts that we make to prevent ever getting into a crisis situation in the first place. And that includes each building has a safety team and crisis prevention protocols at each building. And their protocols are describing how they're going to address a crisis should it happen. Who are the people involved, what are the processes that they're going to use. So they have created protocols at each building by the safety teams, and we'll talk more about those in a second. We have done a lot of training on de-escalation. Again, these are techniques that teachers would use to de-escalate a situation, causing it not to get to a crisis level. And then effective functional behavioral assessments and behavior intervention plans that we'll talk further about. So that's how we try to prevent crisis in the first place, hoping to never get to crisis intervention, which is the big changes for the district in that area is that we're no longer allowed to use seclusion, and physical restraint may only be used when there is imminent risk, and we'll describe both of those situations. But those are the 5 big changes. So when we talk about the protocols that the safety teams create, the safety team refers to a group of school staff who respond to behavior crisis involving students in their building. The protocol refers to a set of procedures and techniques designed to prevent and de-escalate behavior crisis and to respond safely and effectively. Each individual building safety team members are identified on the district website. So if you go to the link there, or if you just go to the Cedar Rapids Community School District website, you will see a section that is for crisis prevention. And if you click on that, you will see all of the buildings listed. And if you click on any building, it will give you the names of the people on their safety team. So our de-escalation training, what de-escalation refers to is a progression of nonverbal, verbal, and environmental interventions used to respond to student behaviors in a manner that prevents behavior escalation and results in a reduction of student behaviors. It's entirely meant just to avoid a student getting escalated and getting into a crisis situation. These de-escalation techniques work very well for children, especially when we know them well. And so that's always our first step. Addressing student behavior in the least intrusive manner is always the highest priority. We try to avoid these situations rather than deal with them when we get there. Functional behavioral assessments is a term that was brought to us by the Individuals with Disabilities Education Act. It's a process used to define a behavior of concern by identifying factors that support the behavior and determine the underlying function or purpose of the behavior. So an expert comes in, they do a lot of observations of a student, they collect a lot of data about the student's behavior, and they're really identifying why is the student having that behavior, what's behind that, what is the function or the purpose of that behavior. That helps us to understand the behavior better, and then we can create a behavior intervention plan, which is an individualized plan designed to respond to problem behaviors identified in that functional behavioral assessment. And through that, we have targeted interventions, instruction, and response strategies designed to reduce or eliminate the behavior of concern. So the FBA and the BIP are very closely tied. The FBA is telling us why the student is behaving in the way that they are, what is the purpose, what is the function of that behavior, and then the BIP is designed around that function and purpose so that whatever we are doing in the area of interventions are specific to that behavior or the purpose of that behavior. So they're very closely tied. We, as a part of the DOJ agreement, we needed to adopt several board policies, and they very clearly define some of the issues that we're working on, such as seclusion. Seclusion refers to the involuntary confinement of a student alone in any room or area which the student is not free to leave or believes that they are not free to leave. It does not include a student going to a room or location voluntarily to engage in calming or de-escalating behavior. So seclusion is a somewhat dated technique where we would confine the student to a room until they de-escalated pretty much on their own. And so now the DOJ has prohibited us from having any sort of seclusion. So we have a board policy specifically saying that. We also had to create a board policy addressing physical restraint. Physical restraint refers to any physical contact between a district employee and a student in which the student involuntarily participates, and it immobilizes the student and reduces the ability of that student to move the student's torso, arms, legs, or head freely. So basically this would be a grab, it would be taking the student to the ground, whatever the case might be, but it's an involuntary on the part of the student, and it immobilizes that student and reduces their ability to move. It's only allowed when a student is engaging in behavior that presents an immediate and imminent risk of substantial bodily injury to the student or others. Or others can include other students, it can include teachers, adults, but it has to be when there is an immediate or imminent risk of substantial bodily injury. And that's defined as involving a temporary but substantial disfigurement or a temporary but substantial loss or impairment of the function of any bodily member, organ, or mental faculties. So the bar is really high as far as what would be considered substantial bodily injury. So you can see that physical restraint really should be a last approach to a student's behavior. The employee involved must only use physical restraint as a last resort after all appropriate, feasible behavior interventions and de-escalation techniques, including those that are identified in that student's BIP, that behavior intervention plan, if they have one, and have been implemented with fidelity and have not resolved the immediate and imminent risk of substantial bodily injury. So what this is saying is that all of the de-escalation techniques that we talked about that people have been trained in, that are designed around the student's function or purpose of their behavior, that's in their behavior intervention plan, we must have exhausted all of that before we would go to physical restraint. If it's a case where the behavior happens very quickly, it may limit some of those de-escalation techniques, but the expectation is that we will have attempted anything we can that we know about the student's behavior that are in the BIP before we would resolve to a physical restraint. The other caveat with physical restraints is only safety team members, you remember those team members that we talked about earlier, may use physical restraint unless an emergency arises where the student engages in or attempts to engage in substantial bodily injury before the crisis prevention team is called or arrives. Crisis prevention team and safety team are the same thing in this situation. We have used the terms differently over the time, but if this occurs, the crisis prevention team will take over the implementation of physical restraint immediately upon arrival. So our safety team members, again, which you can find by building on our webpage, they have been very carefully trained in physical restraint. We have a particular technique, a program that we use here called Safety Care. That has been approved by the DOJ, and they have been very specifically trained. It's a pretty involved training on how to use physical restraint, so no one else in the building but those team members should be attempting to physically restrain any students. There are times, however, as this says, that an emergency may happen, and in order to protect that child or other people, they have to do a restraint, but immediately when a safety team member arrives, the safety team member must take over. Physical restraint of a student will end as soon as the student's behavior no longer poses an imminent risk of substantial bodily injury to the student or others. Our physical restraints are usually very short. They're seconds, as a matter of fact. We're not talking minutes. We do have a procedure if a student is not able to de-escalate what the building should do in that case, but it rarely happens. And so our physical restraints are very quick. Students de-escalate very quickly, and then we let them go. It's not meant to restrain them for any period of time. The employee involved must only use physical restraint as a last resort after all appropriate feasible behavior interventions and de-escalation techniques, including those set forth in the BIP, have been implemented with fidelity and have not resolved the immediate and imminent risk. Physical restraint will only be used for minimum time necessary to prevent the risk of substantial bodily injury to the student or others, and must never be used as a punishment or to enforce compliance with rules or directives. It's not a punishment. It is meant to stabilize the student to reduce imminent and immediate risk. After physical restraint has concluded, the district will provide counseling or psychological services or supports to the student from a school counselor or other licensed behavioral health professionals immediately or no later than the end of the following school day. This is to make sure that the student's okay, that they're able to debrief, they're able to talk about what happened. And in our case, that is almost always provided by the school counselor. Subject to obtaining parental consent, the district will also complete an evaluation of the student to determine if additional behavioral health services are required. The counselor behavioral health professional will process with the student to reestablish a sense of safety, connection, meaning, and efficacy into the school environment. So parents are given an opportunity if they should choose to have additional assessments conducted on their child, if they want to have their child, if they're not in special education, receiving special education services at the time, if they would like their child to be evaluated to determine if they need special education services. In a case of a student who already has an individualized education plan, parents may want, but it's not about behavior, parents may want additional assessments in the area of behavior in order to try to get to the bottom of some of the behavior. Again, through the functional behavioral assessment, which may lead to a behavior intervention plan. If the student makes any overt or perceived threat of suicide or engages in an act of actual or mimic self-harm, district procedures for suicide and preventions must be immediately implemented with fidelity and documented. So those are the big highlights of the DOJ agreement. We have, again, we have the QR code there for questions. Please submit your questions if you should have any. Again, it helps us to make sure that our communication about the agreement is appropriate to your needs and answers any questions that you may have. Thank you for your attention tonight, and be safe with the roads. Thank you.